Unfortunately, sometimes things can go wrong. Cells that undergo rapid changes during embryonic development require coordination of highly complex processes, including cell division, cell specialization, and cell-to-cell communication. When things go wrong in such a complex process, and they often do, the results are usually lethal, resulting in early miscarriage. Sometimes the embryo will develop abnormally, but not miscarry. There are literally thousands of possible errors, but we will consider only one type, called neural tube defects. These are relatively common, can be screened for in early pregnancy, and best of all, can largely be prevented if the woman takes supplemental folic acid for preferably 3 months before getting pregnant and for the duration of the first trimester. There are 2 types of neural tube defects, anencephaly and spina bifida. Anencephaly means failure of normal development of the brain and top of the skull. Most of the brain tissue is absent. It is a lethal abnormality caused by failure in the development of the neural plate. Spina bifida means failure of normal development of the backbone and the membranes that cover the spinal cord. The effect on function after birth depends on the location and extent to which the backbone and spinal cord are affected. Many babies affected by spina bifida are unable to use their legs, which is also called paraplegia, and have abnormal bladder and bowel function. Spina bifida occurs when an opening in the neural tube called the posterior neuropore fails to close. Many countries offer screening in early pregnancy to detect abnormal embryos and fetuses. As treatment for severe developmental abnormalities can't be offered, all that is available is early termination of the affected pregnancy. This is distressing, but for women who choose this option, a lot less distressing than continuing with an abnormal pregnancy.